And Mayor Myrick's controversial plan to stop heroin deaths is gaining national attention as well as the attention of lawmakers on Capitol Hill. WENY Washington correspondent Kelly Meyer talks with Senator Kirsten Gillibrand to see if she'll be following in Myrick's lead.
The Ithaca, New York mayor says American communities can't wait for the federal government to address the heroin epidemic. But lawmakers on Capitol Hill continue to draft their own legislation to fight the problem. But which approach will work best? And do they agree with his controversial move?
I think what the mayor is trying to do is prevent more deaths from overdoses. And that's what our legislation is trying to do as well.
Fellow New Yorker Senator Kirsten Gillibrand understands Mayor Myrick's efforts to address the problem. But Gillibrand says while Myrick is focusing on helping those after they become addicted, she wants to prevent the addiction before it starts. Her legislation in Congress focuses on the overprescribing of opioids. She says when doctors give out too many prescriptions, it increases the risk of addiction. When prescription drugs become too expensive, that's when the users turn to drugs like heroin.
If a kid is given an opioid while he's in high school, he's 33% more likely to become addicted to opioids after high school.
It's a vicious cycle all too familiar for West Virginia Senator Shelley Moore Capito.
Tears families apart.
Both she and Senator Gillibrand have asked the Centers for Disease Control and Prevention to issue guidelines for the safe treatment of acute pain, like a broken bone or taking out a wisdom tooth. CDC currently only focuses on guidelines for chronic pain. Mayor Myrick's plan to combat opioid abuse takes a page out of Europe and Australia's plans. In places like Australia, dealers are considered illegal, but the users have the chance to come forward and get the help they need without fear of facing charges. While Senator Capito doesn't agree with Mayor Myrick's plans, both she and Gillibrand say they hope to take examples from local and international government to find a way to solve the problem.
We need to work together, both health and law, education professionals and government professionals, to make sure we're doing as much as we possibly can, or we're going to lose a generation.
Both senators agreed it isn't a matter of federal government versus local. The sooner they can all work together, the sooner more lives will be saved. Reporting from Washington, I'm Kelly Meyer, WENY News.